who is joining us this morning once again. Good morning, Nadia.
Good morning,
Thank,
Paul. Good morning, Rahma. Good
thank you for
morning.
joining us here again. Hope you're doing well. Let's get right into our discussion. First off, let's touch on the new variant that is the AY42 variant. Has it been discovered in Indonesia? And is there anything that we can do to prevent this variant from spreading here?
Yes, first, of course, there should be, we need to prevent this variant AY4.2 spreading in Indonesia. And up to date, we haven't detected this variant entering Indonesia. Although some countries like Singapore, Malaysia, even India have report to GIS that they already found this variant entering their countries.
Okay.
Okay. So what are the government's policies towards foreign arrival, especially from Malaysia and also Singapore, where the variant has been reported?
Yeah, so I think in terms of preventing this new variant entering to Indonesia, of course, we are strengthening our quarantine system, which include that every travelers who enter Indonesia have checked their COVID status by having a PCR test 3 times is negative. Like the first test, they should do 3 days before departure, and then they have like twice test in Indonesia during quarantine. And if they already have a complete vaccine, which means that they already get 2 shots, they can go for quarantine only for 3 days, again with the 2 PCR test negative. And then if the travelers only got 1 shot, they need to go for 5 days quarantine. And all the positive cases should be tested for the whole genome sequencing. So with this, we can identify what the variants in the positive cases that we found from the travelers. The other thing is, of course, like Singapore and Malaysia currently is not yet included as travelers that allowed to enter Indonesia, because we have a criteria for countries that have been agreed to enter to Indonesia is just like 19 countries, yeah. So foreigners from other countries outside of these 19 countries is not yet allowed, which including like Malaysia and Singapore, because we have a criteria. The first one, when we open our port for entering the travelers, the original of the traveler should be the country who already in the green light, which means that they are coming from the country who have level 1 or level 2, and their positivity rate should be less than 5%.
Right.
Okay, so we're definitely playing the numbers here. Now, Nadia, as we know, we've also seen European countries, North American, as they head towards winter, case numbers have started to go up. And depending on the country, they've all reacted slightly differently. Some of them have imposed heavier restrictions, such as lockdowns. Some, like Germany, have opted to try to keep business as usual. How about in Indonesia, though? What is the plan basically for the government in case numbers do go up here? We do know that PPKM level 3 will be implemented between Christmas and New Year's, but that's in anticipation and to try to keep those numbers low. But what if the numbers do go up? Does the government have plans in place, and do we know what sort of restrictions we'll be looking at?
Yeah, of course, we learn from experiences from other countries, which currently they already reach target for vaccination. So like almost 70% of their target have been reached. Yeah. But when it comes with the new variants, which include might be like the AY4.2 new variants, and we also know that the Delta variant has already so many subvariants. Yeah, currently like 45 subvariants of Delta.
Wow.
And in Indonesia itself, we already identified like 22 subvariants, which means that third wave is potentially will be come if we are not mitigate or if we are not prepared very well. So of course we start the preparation in order to prevent the third wave. It should be from the upstream. Yeah, if we can see, of course, that we again we cannot we cannot avoid the high mobility because once many relaxation we have come with the lowest level of the PPKM, so the increasing of the activities at the community it will be goes up. So it means that this high mobility it might not avoid, but in terms of maintain the mobility should not be contribute to the number of the cases of increasing of the rate of transmission. We still can do in terms of prevent it by having the health protocol implement very well in community level. So again, the increasing of the mobility should be balanced with the high implementation of the health protocol. So this we should done earlier in terms of prevent of course the increasing of the cases, and we also know that we are using like Peduli Lindungi application in order to check whether people who are having activities at the public places, they should not the COVID-19 cases which with no symptoms or the one who are a close contact, which means they should not go in the public activity, because we know that if this kind of person are having activity as the at the public place, so of course it will be put a risk on other person who are having the same activities.
Sure.
And of course, if we are talking about the health facilities, learning from what happened in July, we are preparing this health facility, which include like the bed should be provided for isolation or treating the severe like ICU and others. And then of course we maintain the logistic supplies such as oxygen and other drugs that we are aware that we need during what happened in the second wave on July.
Okay. Now, Bu Nadia, prevention is always the key regarding to COVID-19 itself, right? So, and you know, to prevent is we need to use our masker correctly, right? Now, sometimes people in the society thinks that you know, you should wear your mask when you go outside, when you step outside the house. But to what our spokesperson said, Dr. Raisa Broto Asmora said that, you know, when you are in a community, a house community, or in the family, amongst family, sometimes we as individuals, we don't use our maskers. Now, what is your thought or the government's thought about that?
Yes, I think that's something that we need to make it clear to the community that the pandemic it has not been stopped yet. We still in the pandemic situation, although we've seen the confirmed case or the death case has been reduced very low currently. We know that the death case is just only like 20 per day. Previously, we have like more than 2,000, and then the confirmed cases is more than now it's only like 300, 500, which previously almost 50,000. So it's really getting better now, and I don't think we would like to lose this condition. That's right, Paul and Rahma. So it's need a real to inform us because this effort is a collaboration between the government and the community, how we tackling the pandemic. So all like the use of the mask, of course, if we are having activities outside of the close or the inner circle of the family, you should go for the mask because you don't know whether this is your close relative,
Right.
or what they are activities,
Right.
and then whether they are carry on any virus. So
Right.
still, if we are not in our household, any activities we should use a mask.
All right, Bu Nadia, as well as events have started to happen again
Yes.
recently. Weddings are allowed to be larger weddings, at least are allowed to happen as well. Now, one event notably is the Superbike event in Mandalika and Lombok, which has actually brought in a lot of athletes as well, teams for the sport, and it is a great event to have. However, has there been any anticipation as to could that create any sort of cluster or any sort of more positive cases, and how is that going to be handled in anticipation?
Yes, Paul. So before we decided to have this like international event or the big event which currently we have in Mandalika, like Superbike currently, I think it's happened this week. We have some preparation before decided these activities can be done or not. So I think before the event itself, the first we know that we make sure the committee and then the local government are really have a strong commitment in terms of prepare this event and in terms of maintain all the safety. So once the event has been being conducted and has been finalized, it should be come with new cases or new cluster. So of course, the first one, Peduli Lindungi, as one the application. Once we know when we enter this event, the Peduli Lindungi will be one tools to screening any participant who attend this, for example, like Mandalika Superbike. So there is two conditions. The first one, of course, they are not COVID-19 with no symptoms or the close contact. And then the second one, they are already tested by the PCR.
Okay.
And then lastly, of course, the vaccination. Yeah, the vaccination will be one of the criteria when we are entering the event.
Right.
And before the event conducted, in terms of we make the surrounded, in terms of the community in around Mandalika, the villager around Mandalika is safety, we try to accelerate the vaccination. So almost like in West Nusa Tenggara, especially around the area that been conducted in for the Superbike, we reaching like 80% or almost like 90% of vaccination for the second shot. We accelerate those areas, and especially across West Nusa Tenggara, currently they have already achieved high vaccination.
Awesome, that's great.
Okay, that's beautiful.
Yeah.
Now, Ibu Nadia, first and second dose have been inoculated to most of Indonesians. Now we are, some of them are like hoping for the boosters to be available ASAP. Now, regarding to this one, when it will be in general for boosters? Soon enough?
Okay, so I think before we are talking about booster, let's finalize the current target, because although Indonesia already achieving WHO target by having like 40% all the vaccinated already reached from the target now. So we have been reached that because WHO said that by the end of 2021, at least 40% of the people got complete vaccinated, and we already done that before December 2021. But of course, we still have a homework because like 58% still not get the complete doses, and if we're talking about the first dose is like 36% not yet been administered. So this should be catch up because we need to have a really herd community established in
Right.
terms of managing this pandemic.
Yes.
But government already have this plan for the booster. But if we see the recommendation, currently the one who got the booster, it should be prioritized to the health worker and the elderly, and which currently we still have a challenge providing vaccination to elderly.
Right.
The target for elderly is still like less than 50%. So
Okay.
I think this group should be have more protection, but they still not reach the number that we need. We aim for the vaccination.
Right.
But of course, I think it needs to complete our current target. 288 million people should get complete vaccination, and
Yes.
later we are talking about the booster.
Okay, so first things first. Now, also another thing that we're looking forward to are vaccines for children up to 6 years old and above. So what is the progress on that?
Yes, Paul. So this is a good news for us. Yeah. So we now for COVID-19 disease, we have again another protection for children under 12 years old. But of course, again, if we see the risk, like I mentioned before, the risk for the children is less than elderly people. So with the current achievement that I've been explained before, we need again to concentrate to reach those elderly people who not got the vaccination, because this is really a real protection, and then this is need to be to be achieved in order to protect our children too, because
Right.
usually adult who the one that bring the virus into the household. And then of course currently we are preparing the technical guideline on providing vaccination below 12 years old, because this kind of children, small children we call it, and it might different when we providing this vaccination activity. First, for example, they might not aware regarding the side effect. Usually, we need to educate the parents to know what really the symptoms once the children have side effect, and then how they manage it to the health facility. So this such as kind, and then the other thing like children which have like a congenital disease, and there should be like a good screening criteria for these small children. And other things, it might be quite challenges, because currently only Sinovac has been approved for children
Right.
under
Okay.
12 years.
Sure.
And then which means that we need to find another like 59 million doses for covering this age group. So
Right.
now we are trying to negotiate with the Sinovac whether they still have stock or when they are able to send it to the Indonesia.
That's actually a good point. I never thought about that, how kids can actually, they're not able to communicate symptoms as well as us. Like
Sure.
if you describe my 6-year-old kid to tell us if you're nauseous, she probably won't understand what that means. She just says, I feel icky. You know what I mean? So yeah, it's true. It's a good point. We do need to make sure that education is key before we start administering it.
I true believe that. So yeah. Now, Even Nadia, let's talk a little bit about the COVID-19 medications itself. Now, has the authorities approved COVID-19 medications like Paxlovid itself?
Yeah, or like a molnupiravir or paxlovid itself, it has not been finalized their clinical trial. Yeah, so we still need waiting for the final publication, and then of course the approval from, for example, like US FDA or other governments for drugs approval. So although we already negotiate with the manufacturer that Indonesia would like to order this kind of drugs, but again, the numbers, and then of course we are waiting for the final of the clinical trial, so we are able really to put this kind of drug into our clinical management in which criteria of the patient. For example, we know these two kind of drug is preventing us to get worse clinical symptoms. So should be good any for mild or even COVID-19 patient who have no symptom at all. So this kind of clinical discussion should be elaborated more once this clinical trial has been finalized and has been any recommendation from, for example, like WHO or from other FDA authority. But of course, the government already prepared by contact the manufacturer, so we not will be late. Yeah, once the drugs is come with the approval and it has been approved that has been really useful in order to prevent COVID-19, especially in severe condition.
And if anything, at least with the hopes of reducing hospitalizations as people with some sort of medication will be able to treat their symptoms at home.
Yes.
Bu Nadia, thank you so much for your time. We really do appreciate this latest update because we are in a good situation right now and we do hope that we can maintain the situation throughout the coming months.
Thank you, Bu. Stay healthy.
Take care. Talk to you soon.
Thank you.
So let's just send another reminder to all of our viewers out there.
Yes.
If you do have loved ones that have not been vaccinated yet, perhaps to remind them that this is somewhat of a necessity if we are to move forward, especially with the upcoming holiday season and big events happening out throughout the country. And do remember as well that we do need to follow all the health protocols. We have heard that some areas have started to lax when it comes to protocols. Just because of vaccination doesn't mean you cannot get COVID-19. So again, guys, stay vigilant.